Hello friends, when we collect the blood and store it in the refrigerator and to be transfused later, can we store it for any duration of time, let's say 2, 3 months, 4 months, 5 months, 6 months, and then still we can take it out and transfuse it? Is that okay? Today's reasoning question is based on this scenario. The question is, if blood is stored for too long, then after the transfusion, there is a risk of arrhythmias. Explain why. So let's understand what happens if the blood is stored in the refrigeration for too long. Let's say blood stored for 6 weeks or longer. What happens? There will be exhaustion of the ATPs. Normally in our body, there is a continuous resource for ATP generation. But when the blood is taken out and stored, the ATPs cannot be continuously formed, new ATPs, and therefore at some point the ATPs are going to be exhausted. So ATPs exhausted. Now watch it. Sodium potassium pump, our champ sodium potassium ATPase, would not be able to function if there are no ATPs. So it would start affecting the function of sodium potassium pump. It will cease to function beyond a certain time period. Now look at the function of the sodium potassium pump. Normally, what the pump does normally in any cell, or let's say red blood cell which is in the stored blood, in its membrane there is the sodium potassium pump, and what it does is throws the sodium out normally and brings the potassium back into the cell. Now imagine if the sodium potassium pump starts failing because of lack of ATPs. The potassium cannot be brought back into the cell. That means potassium will start rising outside the cells in the plasma. Plus, additionally, intracellular potassium also starts leaking out. The result is that plasma potassium levels will begin to rise. Even in that stored blood, there are RBCs and surrounding them is the plasma. So plasma potassium levels in that stored blood will begin to rise as a consequence of failure of the sodium potassium pump. This is what is called as hyperkalemia. Yes, increase in the plasma potassium levels is called as hyperkalemia, and hyperkalemia is likely to cause arrhythmias when this stored blood is transfused. It has got high potassium levels in the plasma and it is transfused into the patient. There are chances of arrhythmias. And why so? Because remember, potassium is involved in the electrical activity in the heart. The potassium is involved in repolarization of the excitable cells. So high potassium levels, if such a plasma or such a blood is transfused, it is likely to disrupt the electrical rhythm in the recipient. Electrical rhythm of the heart will be disrupted and it will predispose to arrhythmias. Apart from that, what are the other factors that will also predispose to arrhythmias? One, we already said, high potassium levels in the plasma or hyperkalemia. There is buildup of lactic acid. Normally in our body, there's a continuous source of oxygen and therefore aerobic metabolism continues unhindered. But in the stored blood, there is no such continuous source of oxygen and therefore anaerobic metabolism happens, resulting in the formation of lactic acid. So there is going to be acidic pH of that blood. There's going to be acidosis. This will also predispose to the arrhythmias. Also breakdown of RBC membranes. Because RBCs have been stored for too long, their membranes will eventually break down, and the breakdown products of those membranes are also likely to cause or predispose to disturbance in the rhythm of the heart. So therefore, if the blood is stored for too long and then it is transfused, it is likely to cause, or it poses a risk of arrhythmias in the recipient. So that was the question for today.